are to keep you out of hospitals and doctors' offices. As well intended as they are, most of my patients, myself as well, when we end up going to the doctor, we end up with more diagnoses and more medications. I often don't go to a doctor only if I have some strep throat. I will go to urgent care. The other thing that happens is when we end up at the doctor's offices or the hospitals, we end up with ginormous, ridiculous hospital bills. And those systems are terrible. They continue to change what we owe, even though we've paid, and it becomes a racket itself. So the more we can know our bodies, know how to take care of our bodies, keep them healthy, the less we need to go into doctors' offices, the less we need to go in for testing and procedures, which all of those create strain on the body, stress on the system. Procedures often can bring toxins into the body, depending on what those are, with medications and sedation and anesthesia and whatnot. We know anesthesia is very, very, very harmful for the brain. So the more we can minimize anesthesia, the better and healthier our brains can be for a lifetime. All medications create burden on the liver and the kidneys because they are chemicals. So the liver needs to process and metabolize those toxins. So that increases burden on the cells, increases toxicity into the cells. And the concept of, as patients get to me often, they've been to many, 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 many doctors, and they've got laundry lists of medications. And when I see those lists, I just think about the toxicity in the system. And it becomes very, very, very hard to work with the tissues and work with the body on a structural level, organ level, when the body is under such inflammation from well-intended medications. And as you unpack the story of every single human, most of those medications are targeting symptoms, and that's what the drug companies do. You have a symptom, we have a drug for it. And then what we're seeing today in advertisements on Hulu is, oh, you're taking a drug for this, now you have this symptom, now we've got a drug for that. So now we just continue to layer on the drugs, which continue to be toxic for the body, and it is next to impossible to overcome and regain your health when you have that many medications in your body. The other harmful thing is when we go to many different doctors, and a lot of times they don't really know. They really don't know. They are just guessing as well. Let's look at some labs. Oh, I see something, so let's give you a medication for that lab. Or your labs are fine, we don't know what to do with you, but maybe you've got some symptoms and let's put a label on you. So a lot of my patients come in with many, many labels. And once you've been labeled with something, for many people, it becomes your identity. And when your label becomes your identity, it becomes very, very challenging as well to overcome and retrain that brain that, hey, I'm sorry that you've been labeled this diagnosis. And sometimes it is important to have a diagnosis and a reason for. But even a lot of those diagnoses these days, as you unpack the story, that diagnosis still doesn't address, hey, here's trauma when you were young. Hey, you hit your head when you were 15. Hey, you had this surgery to your digestive system that has now resulted in some gut issues. You know, the food you've been eating, antibiotics. The diagnosis doesn't address or even look at, here's your history of what's happened to you and to your body throughout a lifetime. Because with most things, orthopedic, chronic health, neuroendocrine, autoimmune, all of those pieces, neurodegenerative, there is a history of impact, insult, inflammation, stress, all of those pieces, genetics as well, all accumulate in a body, and they accumulate at different speeds depending on how much you've endured. How early in your life did you start to endure trauma, insult, injury? And what are your genetics? You know, do you tend to become more inflammatory easily? So those are all variables that come into play when a body and somebody accumulates so much, and the body can only take so much, and then it starts to tip into disease. We start to get symptoms, and symptoms are the body's way of trying to tell you, hey, I need some help. And unfortunately, today's medical system says, hey, you've got a symptom, I got a drug for that. And that's not addressing what the body is asking for, needing for, and that is the brilliance of functional medicine, the brilliance of the work we do in integrative manual physical therapy through the visceral, vascular, neural work that we do with our hands, what our hands can identify and perceive in the body to help number one, understand a lifetime history of things. Here's why we're having some issues. We don't exactly know sometimes, but hey, there's a lot of things that have happened to your body, right? And the body can only take so much, and then it tips. So as we help people understand the whys, and then we give them the tools to help them support those old injuries, those old whys, help unburden the system from inflammation, from structural tension, how we can help that body work better, both by what we do with our hands in the clinic, how we guide them from our functional medicine work, and what they do at home. We can help somebody's body restore to a better place of health. And when the body is in a better state of health, a better state of balance, when all the systems can work without strain, without burden, without this chronic need to address inflammation, you start to feel, not only do your symptoms get better, but you really start to feel good. And it is possible to do it, but not with layers and layers and layers of medication. You've got to have the tools and the strategies to understand your own body and how you need to support your own body. And that is our job, to